In the name of God, in this session we are talking about the thyroid gland, the physiology and the mechanism of thyroid hormones, and also a little bit about the pathology and the diseases of thyroid. In the first slide, we can see the location of the thyroid gland in front of the pharynx, and if we cut the thyroid glands and the to see the histological slides, we can see in these sections, in slide sections of histological slides of the thyroid gland, that it consists of some follicles. And they have these follicles. We in these slides we see the follicles inside of the thyroid gland. Some of them are active, and some of them, which are the cells are flat, they are inactive. They are surrounded by vesicles, a lot of blood vessels. They are surrounded by a lot of blood vessels because for formation of thyroid gland we need the iron iodide, and this iron must enter from the blood circulation. And they have just one layer of the cells, the follicular cells. The follicular cells are responsible for formation of thyroid glands. And the inside of the follicles, we have some liquid. It's not exactly liquid. It's a very viscous liquid and sticky liquid, and we call it this liquid as colloid. Inside of the colloid, the T3 and T4 hormones are stored before going and entering to blood circulation when it's needed. Now, in the third slides, we are a large one follicle of one cellular of these follicles, and we want to see the mechanisms of creation and formation of thyroid gland. The first step, this cell has one face close to the colloid, and the other face, we call it the luminal face, and there is the other face which is close to the blood circulation and blood vessels, and the sodium potassium ATPase pump is located in this layer. We call this layer as basolateral layer. And there is another pump, an IS, which this is a co-transporter which inter sodium to ion sodium with just one ion of the iodide. And it's the mechanism of this pump is secondary active transporter. It's dependent to the work of the sodium potassium ATPase. After entering to the cytoplasm of follicular cell, it must go inside the colloid and just go through the other side. For this one, we have pendrin. Pendrin is an exchanger between chloride and iodide. So iodide with the in the ion form just enter the colloid, but it must attach to the tyrosine amino acid. And the first step for formation of T3 and T4 is attaching the iodide, but not in the ion form, but in the molecular form to just tyrosine. Uh, but tyrosine not independently and individually attach the iodide. It just creates a very big protein molecule which we call it thyroglobulin. Thyroglobulin, like the other proteins, are formed in the rough reticular formation, and after passing from the Golgi, it will go to the uh, colloid space. So, what is the specific or the characteristic of thyroglobulin? Thyroglobulin consists of at least 70 of tyrosine amino acids. So, the most part of the thyroglobulin consists of the tyrosine amino acids. After entering to the colloid space, the iron iodide must form the molecular. So, and for this one, it needs a peroxidase. The name of the peroxidase, which can transfer the electron from the iodide to the H2O2, is a TPO, or thyroid peroxidase. The thyroid peroxidase is very important for many steps for formation of T3 and T4. After being in the molecular form, it can attach the thyroglobulin. Sometimes just one molecule of iodide attach tyrosine, and we call it MIT, or MIT. This is the abbreviation for monotyrosine iodide. It's not T3, it's just the tyrosine which attached one molecule of the iodide. Sometimes there are two molecules of the iodide attached one molecule of tyrosine. In this condition, we call it DIT, or DIT. This is the abbreviation for uh, diiodide tyrosine. Uh, so at the end of this stage, we call this stage as organification, and TPO is necessary for organification. At the end of organification, we have a big molecule of the thyroglobulin. Some of the tyrosines are free without attaching to the iodide. Some of them are in the form of meat or DIT. But for formation of T3 and T4, we need the close decoupling between DIT and meat, or meat and DIT and meat, and or DIT and DIT. If two DIT will be coupled, we call it T4. It can form T4 hormones. If one meat with one DIT will be coupled, the creation is T3. Most of the hormone which is attached to the thyroglobulin inside the colloid is in the form of T4. But after releasing to the blood circulation and after entering the cells, the target cells, it will convert to T3, because the receptor for thyroid hormone mostly recognize T3, not T4. Sometimes our body needs, it's in the lack of the T3 or T4. For this reason, the pinocytosis will be happen. Some part of the colloid, which consists of thyroglobulin, will be swallowed in the vesicles. We call it this colloid droplet then will transfer by proteases, because it's normally most of it is protein. After the action of the proteases, T3 and T4 will be released to the blood circulation. But what will happen to meat and DIT and the tyrosine? The tyrosine will go to the other cycle for creation of thyroglobulin. How about DIT and meat? The iodide, which is attached to tyrosine in DIT and meat, it's very precious, especially for people who are not close to the sea, because of the lack of the iodide in many countries. And for this reason, the iodination will be happen. It means detachment of the iodide from the tyrosine. This will be happen by the iodinase enzyme. Some people has lack of this iodinase, and because of that, they will go to the hypothyroid condition. Normally, the organelle inside the cell which determine that how much ATP will must be created from the source of the energy which enters the cell, it's mitochondria. So sometimes instead of creating ATP, the cell just creates the heat. So in this condition, mitochondria also can create heat. But we see that after injection of T3 or T4, what will happen? The number and the activity of mitochondria will be increased. Why it must be happen? Because the mitochondria is creating ATP. It shows that by increasing of the number of mitochondria and the activity of the mitochondria, we can understand that the cells need, in the presence of T3 or T4, more ATP production. But why? Because there is a pump in every cells, which this is the sodium potassium ATPase pump, which consume ATP, and this pump exists in every cells and just consume a lot of ATP every day. So we can understand that the activity of this pump is increased under the control of T3 and T4, and because of that, our body needs to create more ATP, and because of that, we need more activity of mitochondria. But why the activity of this pump must be increased? Because under the control of T3 and T4, the leakage of sodium into the cells will be increased. So the permeability of the cell membrane to the sodium ion will be increased, and because of that, um, we need the more activity of sodium potassium ATPase. Also under the control of thyroid hormones. So we understand that under the control of thyroid hormone, the activity of many organs will be increased. Almost all organs will be more active under T3 and T4. So in the next slide, we can see the net effect of the T3 and T4 on nervous system. In this slide, we're talking about for the effect of T3 and T4 during developmental period or embryonic period. T3 and T4 is essential for myelination of axons of the specifically of cortical region, also for creating the branches of dendrites, which is essential for learning and memory. So without these branches, our learning and memory and the synapses for which used for learning and memory will be defective. And also it's necessary for the vascularity of the brain. So because of that, if T3 and T4 will not be enough during embryonic period, what will happen? The infant will go to the hypothyroid condition, and it will be cretinism. What is it? Cretinism is congenital mental retardation. But normally, if the fetus will be hypothyroid, if the if the if the infant will be hypothyroid but the mother will be normal, what will happen? Because of the transfer of blood circulation from the mother to the infant, the level of the T3 and T4 will be normal in the fetus. So normally this fetus will be okay after birth. But after birth, there is a golden time, and if the T3 and T4 will not be enough during this time, we will have the congenital mental retard or cretinism. In the next slide, we see the net effect of thyroid hormones on the other organs in the body. Normally, the effect of the thyroid hormones is mimic sympathetic. So it's exactly like the flight or fight condition. But in other organs like cardiovascular, like nervous system, and also for muscles everywhere, normally the function of that organ will be increased under the control of T3 and T4. Also, the need for vitamins will be increased, and also the balances between hormones will be imbalanced under the hypo or hyperactivity of the thyroid gland. And but the net effect is increasing basal metabolic rate. So the effect of thyroid hormones will be, we categorize it as increased blood flow and cardiac output, and increased heart rate, increased heart strength, But in long term, because the muscle will be fatigued, the heart strength will be decreased. In hyperthyroid persons, for a long time, the strength of the muscles, specifically the heart muscle, will be decreased. Normal mean arterial pressure we have in hyperthyroid persons because because the differences of the systolic and diastolic pressures will get normal arterial pressure, mean arterial pressure, of course. We need the increase in the respiration because for more basal activity, for more metabolic activity, the body needs the consumption of more oxygen. And also in the gastrointestinal motility and the secretion, we have an increase. How about the effect of the central nervous system? It's after birth, I mean, it's not in the developmental period. The person will be restless and agitated, and also it cannot concentrate it very well. And also they feel most of the time fatigue, and the hyperthyroid person shows some muscle tumor, and it also disturbs the other endocrine glands, specifically the sexual function will be disturbed under the in hypo and hyperthyroid hormones condition. But the thyroid glands they are under the control of hypothalamus and pituitary axis. From the hypothalamus, the TRH will be released. TRH will be released under two conditions. One is cold, the other one is starvation. After that, it stimulates the production of TSH, thyroid stimulating hormone, from the anterior part of the pituitary, and it will go to the thyroid hormone, and after attaching to the target receptor, it will increase every step of formation of T3 and T4. So it not only every step for formation of T3 and T4 will be increased under the control of TSH, but the number and the size of thyroid follicles will be increased. So in persons which have high level of TSH, the greater endemic greater will be created. So TSH increases. The first step after increasing TSH is proteolysis. This is the fast and the first step after increasing TSH, because the body needs more and more T3 and T4. So the previous stored T3 and T4 in the follicle must be released to the blood circulation. The second step is increase the activity of iodide pump, NIS, which will be discussed earlier, and the third step is increasing the iodination of tyrosine. This is the organification. The fourth steps is increase the size and the secretory activity of thyroid cells. Also, the number of the thyroid cells will be increased. So, in the next slide, we are talking about the TSH and the axis of TSH and TRH. In the next slide, we are seeing that the TRH is under the control of two factors, because TRH is secreted from the hypothalamus and the center of the temperature is located in the hypothalamus. So cold has a positive effect for creating TRH. The other one is starvation. In starvation, starvation has a negative effect for producing TRH. So the situation of nutrition and the situation of temperature, both of them are controlling the level of TRH in the blood. But when the person is hyperthyroid, we have some anti-thyroid substances which can suppress thyroid secretion. The first one can suppress the NIS pump. Any any negative ions like perchlorate, nitrate, thiosinate, all of them, because they are in competition with the iodide, they can decrease the iodide trapping the enter of the iodide into the cells. So because of that, the creation of T3 and T4 will be decreased. The second one is proprietary drugs. They are decreases the thyroid hormone formation because they will inhibit TPO, the peroxidase, which will be discussed earlier. But both of them, the first one and the second one, because the number of T3, the level of T3 and T4 will be decreased in the blood circulation because of the negative feedback will be removed in the axis of hypothalamus and hypophysis. What will it be happen? The level of TSH will be increased in these persons, and because of that, the number of the follicle cell will be increased and the goiter will be created. But the best choice is using iodide in high concentration. Normally, the iodide has two effects. In normal level, it will be persuade the formation of T3 and T4, but in the higher level, higher concentration, it will suppress the conformation of the T3 and T4 without any effect and creating the goiter. So and in the next slide, we are just categorized the hyperthyroidism the effect in the body. The persons with hyperthyroidism, they are nervousness, heat sensitivity, sweat, they have sweating, they have weight loss, although they have very good appetite. So these persons are very tiny persons. They have, although they are very tiny. They had heat sensitivity and they have tachycardia, palpitation. Their muscles are weak, not only in the somatic muscles but also in the heart muscles. Their skin is moist and they have show some sleepless, they show some tremor, and they have also diarrhea in the they have also some diarrhea in the gastrointestinal. The persons with hyperthyroidisms, normally they most of the time it's a condition of immune system disorder because they're in the blood circulation they show some antibody. This antibody is exactly look like TSH, but in contrast to TSH, which is attached to the follicle cells transiently, this antibody just attached to the receptor of TSH and in very long lasting time. This and because of that, it's very hard for these persons to remove the to be controlled the creation of T3 and T4. In these persons, in hyperthyroid persons, which show some antibody, we call it the Graves disease. The other name for these persons, the hyperthyroid persons with antibody, with autoimmune antibody, we call it Graves disease, and the other name is thyrotoxic disease. They show also that this immune antibody have receptors on the soft tissues behind the eye, and because of that the involvement of the eye will be happen. We call it the exophthalmos, but after curing these persons it will be okay. About the hypothyroid persons, most of the time the hypothyroid persons are show some antibody also. It's also an autoimmune disease, but in contrast to the other to the hyperthyroid persons, this antibody will be created after some inflammation in the thyroid gland, and after that it will little by little destroy the gland. So, what is the symptoms of hypothyroid? In the total, in the complete form of hypothyroid, which we call it myxedema, myxedema means that T3, the level of T3 and T4 in the blood circulation is close to zero. So, it's very probable that these persons will be die. The symptoms are exactly opposite to the hyperthyroid. They have muscle weakness. Most of the time, they are very slow persons, sleepy persons, sluggish persons, and these slow persons, it's not only in their physical activity but also in their mental activity. They are not very sharp persons. In the gastrointestinal, they show some constipation. They are their appetite is not very much high, but their weight gain is very evident because their basal metabolism is very low. So in the final slide, you see the shape of a person of myxedema. Okay, this session has been finished. If you have any questions, please send me and give me the report that if this session was useful for you or not. Thank you for hearing this lecture.